Mula sa ating pagkapanganak hanggang sa ating paglaki, napakahalaga ng parte ng ating mga ina sa ating buhay. Ang kalusugan ng isang inang nagbubuntis ay napakasensitibo at nararapat na napagtuunan ng pansin upang masigurado ang kaligtasan nila at ng kanilang dinadala. Magandang araw mga mommies! Ngayon sa Well O'Clock, kasama natin sina Dr. Rowena Sese at Dr. Alene Del Rosario ng OB-Gynecology Department ng Our Lady of Lourdes Hospital upang pag-usapan ang Safe Motherhood.
Well, safe motherhood means ensuring that the pregnant woman receives the proper prenatal care and safe childbirth, and of course, ensuring that she gets the proper care after delivering her baby.
Yeah, so actually yung motherhood is really a journey. So it starts even before a woman gets pregnant and then go through a safe and a very satisfactory pregnancy all the way until manganak yung mom.
Although most pregnancies go on smoothly with proper prenatal care, it's also good that the pregnant woman are aware of the risks I'm going to mention, so she gets to know the significance of prenatal care. So risks in pregnancy may involve having a miscarriage or maybe a preterm birth, and probably, well, unfortunately, some women may have stillbirth. And some also may develop diabetes in pregnancy or elevation of their blood sugar or even their blood pressure. And some may experience hemorrhage, and hemorrhage can happen in any trimester, early, middle, or late in the pregnancy. And some of these patients may undergo an unplanned cesarean birth. And of course, some women may develop mental health issues like anxiety and depression during pregnancy.
Difficulty during pregnancy can actually happen at any time. So from the first trimester all through the third trimester. So that's why women are also advised na dapat magpapa-check up talaga regularly with their obstetricians kasi hindi natin alam when exactly mangyayari yung things that sana hindi naman, pero unexpectedly they do happen.
Prenatal care is the most important aspect in a pregnant woman's life. And she should have regular checkups with a doctor, with her obstetrician, because it promotes maternal health. Because there is the ability to diagnose whether the patient is developing hypertension or diabetes in pregnancy. And in that manner, complications to the baby can be prevented.
A healthy lifestyle doesn't actually start when a woman is already pregnant. So it should start even before a woman begins her pregnancy journey. So, and just a footnote that a healthy lifestyle is not limited to just pregnants. It's for all of us, okay? But more importantly, for pregnants, basically a healthy lifestyle will boil down to a healthy diet and then good physical activity in terms of exercises. And then, of course, we try to move away from too much stress, whether we're at home or at work. So pregnants are not spared from all that stress and anxiety. And those are the things that we need to really control if you want a happy and a healthy pregnant. Managing anxiety and stress and even depression in pregnancy is much like managing stress and depression in a woman who's not pregnant. But of course, hormones play a big role. So pregnants might be having more stress or more anxiety and even depression compared to those who are not pregnant. Diba? But basically, pregnants can minimize their stress by taking on activities which relax them. So they're not really prevented from doing yoga or very light exercises or even listening to music. They can go running if they want to, if it distresses them. So whatever can alleviate a pregnant's pent-up emotions and sad emotions, then they can do it. So there's nothing that restrains them from doing things that could give them relaxation. Okay, so in terms of tests and procedures, there are tests that are done from the first trimester all through until the third trimester of pregnancy. So basically, these are blood tests and ancillary procedures, mainly ultrasound. And these are the tests that we do from the first trimester of pregnancy, a set of tests and procedures also done during the second and the third trimester. So basically, your blood tests are a complete blood count, your screening for infectious diseases. So, the infectious disease screens we do basically because there are certain infections that can actually affect your baby, and there are very treatable infections, so that problems in the baby will be avoided. And then for ancillary procedures, our friendly ultrasound is what we really do from the first to the second to the third trimester. So the first trimester ultrasound you do to check if it's a good pregnancy in terms of if it's inside the uterus, if the baby has a good heartbeat. And then for a second trimester ultrasound, you do a congenital scan to see if baby has any probable congenital problems. And then for third trimester, we still do an ultrasound just to make sure baby will be okay until the baby gets delivered.
We monitor the growth of baby with the use of our ultrasound. And ultrasound has been very useful, specifically for obstetrics. Yes, because it makes us sort of get an image of the baby inside the uterus. That's the way that we monitor baby's well-being as well as its growth.
Yeah, and then just one more note on ultrasound. Okay, so mommies are so happy when they see the face of their baby on ultrasound, especially if you do your 3D or 4D ultrasound at about 7 to 8 months age of gestation. So most moms would want a 3D or 4D ultrasound just to see their baby inside.
And to also determine the
Gender, yes.
which is important for them.
Salamat sa panonood. Kung gusto niyo pang matuto ng ibang kalamang pangkalusugan, huwag kalimutang i-like at i-follow ang official Facebook page ng Our Lady of Lourdes Hospital. Hanggang sa muli, kita-kits tayo sa susunod na episode ng Well O'Clock, kung saan well ang well-informed. Para sa mga katanungan tungkol sa inyong kalusugan, tumawag lang sa 8716-3901 Local 1205.